So when some clinicians hear about standardizing care for our patients and trying to do things more efficiently, we're met occasionally with the charge of cookbook medicine. And that's a term that is particularly bothersome to me. And I'll actually use a cooking analogy to make my case. You know, even great chefs use recipes. I've used the analogy before of making a roux. And, you know, a roux is a very simple recipe. It's 50% fat and 50% flour. And that's the recipe for roux. 1-to-1. Now you can change the fat. You can use butter. You can use clarified butter. You can use oil that'll take a lot of heat. You can also modify the recipe in terms of the color of the roux, right? You can stir that thing for 2 or 3 minutes and you have something that's just barely light brown. You can stir it for 5 minutes, start getting a kind of deep gravy brown. You can stir it for 6 or 7 minutes and you start looking like chocolate, and you can sit there and stir it for 10, 12, 15 minutes and you can get something that's almost black without burning. And you'd use them in different ways. But the recipe is the same. It's 1-to-1 fat and flour. So too in healthcare, when we know that every patient who's on a ventilator should receive certain evidence-based treatments, that's the recipe. And we know if we do those things, we'll get a good outcome, and if we don't, we'll get a bad outcome. There's still plenty of room to, you know, apply art in medicine, to apply individualization for that unique patient's needs in their ventilator care, but there are components of the bundle that must not be missed because that's the recipe. So just like that roux, where you can change the fat, you can change the time and get different outcomes, so too there's plenty of room for art in medicine and individualizing care. But when we have recipes, that's called evidence-based medicine, and we should follow those. We say that we're different from other healthcare providers because our work is illuminated by the light of science. Then we'd better follow our science.